Hello everyone, welcome back to Nursing with Bonomi. It's Nurse Nate, and today we are going to talk about progress notes for a patient who's exhibiting behaviors. I want to thank Mercy Zagrocki 94834 for requesting a video about behavior progress notes. So sometimes you're going to get patients, particularly if you work in a dementia unit, that have behaviors, or other patients that may be confused for other reasons, like encephalopathy or something. But then you're also just going to get patients who are rude. I like to blame that on the fact that they don't feel good, but some people are just not nice. So here is an example of what you can put in a progress note for somebody having behaviors. It's good to be very specific, and you can quote them actually as well. So here's an example for somebody who has anxiety or tearfulness. I had a patient on the dementia unit that would just cry all the time, walking back and forth. It was really sad. But here's an example of what you could write for that. So patient anxious, pacing the hallway and crying. Continues to ask where deceased husband is and is unable to be redirected. Patient was provided with a snack, activities, and spoke with daughter on the phone. Lotion was also applied to hands and arms. These interventions were not effective. MD notified. New order received for a medication. Daughter notified. Medication effective as patient is now sitting quietly in the common area folding towels. So this is an instance where the patient was having behaviors and they were unable to be redirected. You tried multiple interventions that were not effective, and so you had to call the doctor and get some medication, which was then effective. If they already had the medication, you could just put that the PRN medication was administered and it was effective. It's always good to put in a few interventions that you tried before giving an anxiety medication. You always want to try like at least 3 different interventions, whether it's food, repositioning, snack, lotion, redirection with a task, something of that sort. Now, here's an example of somebody who is exhibiting violence toward the staff. So you can say, during personal care, patient became very combative, hitting and biting staff. Patient was left in bed at lowest position to reduce risk of harm to self and additional staff. MD and family notified of this occurrence. New order for this or that. So they may or not provide a new order for something. Sometimes a patient just needs to calm down. Maybe they're hurting. If they're confused, they might be having pain. You can administer some Tylenol or other pain medication that they may have ordered. And then it's also important to refer to your facility policy when it comes to this type of situation. There's usually paperwork to fill out when a staff member is harmed in any way. So you want to refer to your facility policy and do that if it's necessary. And it also may require some sort of incident report. So just go along with what your facility requires. And also, if they're yelling and screaming at you, it's important to put those words, just quote them in the progress note. Even if they use profanity, it's okay. Spell it out and put exactly what they said, because you need to have that information documented. It's really important too if they are alert and oriented and they're treating you like that. Additional steps might need to be taken, especially if they're in the nursing home. They might not be allowed to stay there any longer. There's just different things that can be done. I hope that this is helpful. If you need more help with progress notes, please make sure to go grab our progress note ebook that has a lot of different examples on progress notes, and the link is in the description. And I hope that you guys have a wonderful day.